Hi, good evening. So, welcome to yet another session on Ayurveda. So, weekly sessions which we have every Tuesday at 9 p.m. Okay, an interactive session. Great. Okay, so today we are going to talk about the management of cough. So, cough is something which is a very common symptom which we see everywhere. All age groups, all regions, every part of the world, we see people coughing. Okay, so the treatment of cough is actually very interesting as per Ashtanga Hridaya. Cough is something which is considered as a disease condition in certain place, and another place it is also considered to be an urge. And okay, when we discuss about urges, so let us start with this. Okay, so how does Ayurveda look at cough? Okay, so understanding cough. So cough, as I said, is a natural urge. It's called a vega. Like 13 different vegas have been mentioned by Ashtanga, like cough, sneeze, passing motions, urinate. That means you are not supposed to hold back when these things come. Burp. Okay, likewise, 13 urges have been told by Ashtanga, and cough is one urge. So what happens why do we cough? Especially the cough comes to protect our, our airways, including the lungs. If there's something stuck here, we immediately we cough to take it out. If there is phlegm over there, we cough to get the phlegm out. Any dust, anything goes, so it is basically to protect the airway. It can be your, air pipe and the windpipe and the lungs. It is called kasa in Ayurveda. Okay, so classification. See, everything as far as Ayurveda goes, we look through the lens of the Tridoshas, Vata, Pitta, and Kapha. So likewise, Kasa also has been divided into 5, and it is Vata, Pitta, Kapha, Kshataja, and Kshayaja. Vata, Pitta, Kshataja is because of some injury, and Kshayaja is because of emaciation. Okay, that means you have been extremely denourished. There are conditions. We'll get into that. Okay, and so common reasons for Kasa. This is what, see, it is basically smoke, dust, exercise in excess. The moment somebody does exercise in excess, okay, especially for a lean person, if he does exercise in excess, he'll get that cough. Dry food in excess, okay, and suppressing cough. So we say that the moment, whenever you feel like coughing and you try to control it, you see that that cough is actually exaggerated. You get more cough. So controlling cough is never the solution. When you get cough it. Even when you try to control sneezing, you end up coughing. Okay. So symptoms. Early symptoms, very important. You feel like something is stuck in your throat. It has been compared with a small thorn, stuck in the throat, and you start feeling the itching. So the moment you feel these things, you should know that if I don't work around it right now, tomorrow it is gonna end up in cough. So understanding the premonitory symptom, early symptom, is very important. Especially what you feel is, you feel like a little bit of itchiness, and when you swallow, you feel better. After that, again itchiness comes. That means it is going to lead into a cough. Okay. Now, other things, how does it basically occur for us? It is pranavayu and udana vayu, which is supposed to move lower, going down. It starts coming upwards, and the sound which it creates, it has been compared to the sound from a broken brass with bhinna kamsyopama dhvani, is what has been mentioned. So when the person coughs, it is like, the sound. So It is, it is basically the vayu which tries to push things out. As a reason we get cough. Okay, so stages. Most stages, when you see, especially in children, most of the coughs start with phlegm. Okay, and then they slowly start becoming dry. They become dry over a period of time, with or without treatment. Even if you don't treat a normal cough, okay, it can subside if you have taken without medicine, if you have taken care about the food you eat and the lifestyle you maintain, like not getting too exposed to cold or drinking cold water and all. If you take care of yourself, most of the cough will subside within 2 to 3 weeks maximum. Okay, without, but if you're really infected and all those things, it can take time. So as I said, it starts with a stage with a lot of phlegm, and then it slowly starts getting drier and drier. Okay, now important step when we are managing it. The treatment is like, we most, as I said, most of the cough, it is presented with phlegm. It can be colorless phlegm, it can be yellowish phlegm, it can be greenish thick phlegm, depending upon the kind of cough it is. It can be blood stained also. So depending upon all these things, we actually classify it into vata, pitta and kapha. And then our main idea is to take the cough from the kapha stage to the vata stage and then pacify it. Okay, so this is the way we manage it. Now, different, as I said, there are different coughs: vata, pitta, kapha, kshatriya, and kasaja. We'll see how which is actually easier to management. Okay, so prognosis we call it. Vata, pitta, kapha are curable. Okay, they are not very severe. They are small infections, or even if they are major infections also, those are the things which we can definitely manage. But Kshataja and Kshaja. Kshataja is, Kshata means injury, something which you get due to getting injured. It need not be a direct hit or something. It can also, it usually happens for people who lift a lot of weight, people in the gym, okay, lean people who go to the gym and try lifting weights beyond their capacity. We say that they get kshata or injury to the chest. Okay, because they hold their air, they have to hold tight, the air, and then lift it. You get injured. So cough can arise because of that as well. That is not something which is easy to cure. And kshayaja is, the cough which comes due to emaciation. TB cough is basically classified under kshayaja. Kshaya colloquially in Malayalam means TB. So cough because of that also is not easy to manage. In the sense, we have to work really hard to manage that. Then the asterisk effort is not easily curable, but depending upon the strength of the person. If the person is strong enough, then we can actually cure Kshataja and Kshayaja Kasa. But if the person is weak, then it becomes extremely difficult, and sometimes it is not curable also. Okay, so this is how the prognosis of Kasa is. This is how we manage Kasa. Okay, so I can see people have started asking questions, and let me not get too much deep into the theoretical part of it. I'll start answering your questions. Okay, so treatment basically is in stages. So if there is a lot of phlegm, okay, vamana, we do make the person vomit if there is too much of phlegm, and sometimes we also make them purgate. Okay, when it is associated with pitta, we make them purgate also. Okay, and then we do the pacification. Or if it is directly a vata kasa, then we do pacifying rather than doing the shodhana, because the disease doesn't have the strength, or the person doesn't have the strength to undergo the cleansing process. And brahmana or nourishment is basically provided in the kasa, in the cough which is due to kshayaja. Okay, and the bottom line is that if not managed well, it could be vata, pitta, or kapha, or anything will actually lead to kasa, which is emaciation, which will actually take your life away. So it has to be managed. Okay, so slowly I'll start answering your questions. Okay, now, yeah, good evening, Aravind, Gana, Ganapat. Namaste. What should I advise for children who are having dry cough? See, very rarely you see children directly having dry cough. Okay, normally it starts with cough, which has got a lot of phlegm. And I would say, as I said before, when there is a lot of phlegm, it is always good to see that the person vomits. There are kids who have got a tendency to vomit when they cough, and though I would say, as far as cough goes, they are blessed because a lot of phlegm goes out. There are some children who don't vomit. It is not easy, but what I do with kids, my kids also, what I used to do is we used to see that the kid drinks a lot of milk. Normally, when the kid drinks in the morning, we'll feed the kid with a lot of milk. And once the kid takes a lot of milk, we take a towel, heat it, and then apply it on the chest. Heat the chest a little bit so that the phlegm in the chest is actually melted a little bit, and then we put a finger inside the mouth of the child will vomit. The moment the child vomits, there's a lot of phlegm that goes out. You will see the child might get angry at you, that's fine, but you'll see a lot of relief because the phlegm comes out in a go. And after that, that's when after that we start giving medicines for converting that. See, there are churnams like Talisa Patra de Churnam, which is a very popular thing. Talisa de Churnam is what some people call. We mix that with honey, okay, to make the cough. It is basically not to completely cure the cough. It will remove the phlegm so that as Gana is telling, after a point of time, you cough and the cough starts becoming drier. So when the cough becomes dry, the medicine does not change. It is still Talisa Patradi Churnam, which actually works really well in cough. What we do is, for when there is phlegm, we have mixed it with honey. Now what we do is we mix it with ghee. The moment you start mixing it with ghee, slowly, and the medicine is not thrice daily or 4 times daily. It is quarter teaspoon every 1 hour. For Kasa, administration of medicine has been told muhur muhur. That means every muhurta, every 45 minutes, you have to give that little bit of dose so that the person gets relief from cough. So Talisa Patradi Churna with ghee can be given for dry cough. Okay. Hello world, which brand soap and toothpaste should we use? Anything which has got very little chemical, I would say would be the best choice. You can choose that. Okay. I use KP Nambudri's, I should not be endorsing that, but still I use KP Nambudri's toothpaste and tooth powder, which works really well for me. And then as far as soap goes, I use Nagarjuna Rakta Chandana soap. Very good one. Okay. Does removal gallbladder due to stones lead to other side effects or imbalance in the body? It's like getting rheumatoid arthritis. Okay. Gallbladder, unfortunately, if you had to remove gallbladder, I don't think it can have that big side effects where it can lead to rheumatoid arthritis. I'm not very sure because I have not come across such cases. But definitely, pitta related and digestive issues are going to be there because gallbladder is a place where the bile is being stored, and whenever necessary it has to get released. But when the gallbladder is not there, there is nothing which stores it, so it has a continuous flow into the into the duodenum. So sometimes your fat digestion is affected. Okay, and you can have bloating and small gastric issues, but major issues like rheumatoid arthritis, very rare. So that's the reason why it happens. Okay, because the storage is not there, there's a continuous flow of bile. Is kumbhaka. Okay, this is for people who don't know what kumbhaka is. You have got in yoga, when you do the breathing, okay, you have got 3 steps. One is puraka. Puraka is filling it, kumbhaka is holding it, and rechaka is releasing the air from your lungs. Okay, so when you hold it completely full, it is called kumbhaka. See, what happens is when you are actually pulling, see, it all depends upon where you are also, Ashwin. Okay. If you are in Delhi in a polluted place, when you hold that breath inside, you're actually holding in a lot of carbon monoxide. Okay. No healing happens, it is actually bad for your health. So if you are in a place where it is clean oxygen, clean air, when you breathe really in, see the body, the pranavaya, the body actually works, and every activity, metabolism works in the presence of good oxygen in the blood. So when you breathe really well and you're holding that breath in your lungs, diffusion happens very very effectively, and your blood is enriched with oxygen. Okay, it is not only your internal organs, every part of your body including your brain, every part of your body heals really well. Why do you want to mix mango with milk? By and large, mixing any fruit with milk is not, there might be some rare fruit which can be mixed, but by and large I would say avoid mixing any fruit with milk. Your smoothies, milkshakes and all those things don't go well. Viruddhahara. Okay, Bhupendra. Chances of having coffee with age, it again depends upon prakriti here. If a person is extremely lean, thin, that means he's vata prakriti, and as he ages he also gets into vata age, and cough or kas is also a vata disorder. So there are a lot of conditions, 1 + 1 + 1, then you are actually prone to cough. And again, what happens with age is sometimes you are not careful when you swallow food. You are not there when you're eating food. You are lost somewhere. So absent-mindedness can actually cause your food to going, instead of going through the food pipe, it can go through the airway and you can get a cough. And your chance of getting an infection is also high because your immunity level goes down. Okay. So there are, as you said, yes, elderly people are susceptible to getting cough if all these factors are there. And probably smokers people who have smoked in the young age and say, no, I have not smoked for the past 10, 15 years. Yes, but all the 20, 30 years which you smoked will definitely have an effect on your lungs because your lungs might be weaker than a normal person. Okay, so you have to stay warm is what I say. Always drinking something hot. Hot water is actually very good, and there are some medicines like probably on the long term, Agastya Haritiki or Agastya Rasayana will actually help you increase the strength of your lungs. And if you still have prolonged cough, then it is always good that you consult a doctor. Arjun tablets good to be taken for cholesterol. I don't know about Arjun tablets. If you meant Arjun or Arjuna, okay, then I would say Arjuna is actually considered to be good for all conditions of the heart. But I'm not very sure whether it is good for cholesterol. And don't be too worried if your cholesterol is slightly here and there. If it is very high, only you have to get worried. Because there are a lot of studies which say that even if, people say it should be under 200 or 190, 170 now. But if it is around 200, 230, 220, also don't worry too much about your cholesterol. Okay. Pooja, weakness and heart palpitation due to improper sleep. Any tips to improving sleep and disturbed mind? Okay. See, Ayurveda says, Nidana Parivarjanam Chikitsa. Removal of the causative factor is treatment. At least more than half the treatment. So what is disturbing you is a question which you have to ask yourself and find that thing. And if that thing has not been resolved, let me put it very clear, Pooja, if that issue is not resolved, your sleep will always be disturbed. Then you'll have to take some sleeping pill which forces you to sleep. That is not a solution. Okay. Apart from that, what do you call, we say, if you're not sleeping well, buffalo's milk at night will actually help you. Applying a little bit of the vertex and pada bhyanga, applying oil on the feet, under the feet will help you. A warm shower before your bed will actually help you. And then, there are some medicines like Manasa Mitra and all those things will definitely help you. But I again come to think puja. It is very important to understand what is actually disturbing you and resolve that. That is the best long-term solution for you. Now, can we give milk to a child who has cough? I think Gana, you asked me about dry cough. If the person has got dry cough, yes, you can give milk. But see, I would always say milk. The source of milk should be very clear. Okay, if it is an A2 milk, organic milk, okay, desi cow milk, which is not injected with all those things. I think milk by and large is not a bad thing. Okay, but depending upon the source, it can go bad. But milk is actually good to a kid who has cough. If the cough is dry, if the cough is wet and the child is used to drinking milk, then I would say it's always good for you to dilute the milk and give it. Okay, the child should be away from curd, banana, too much of sweets, ice creams, anything cold if the child has got cough. Can you advise best over-the-counter medicine for general fever? Uh, there is one medicine called Pyrid, Pyrid. It's an Ayurvedic medicine from a company called Nagarjuna that works really well. Then you have got traditional preparations like Amrita Rishtam, which is a liquid which can be taken. It work wonders for most of the fevers. There's something called Surya Prabha Gulika. But I would still say, you should understand why the fever has come and then work around it, rather than just popping a pill to manage the temperature. Suma, I didn't understand your question. My 65 year is very. I didn't understand that, Suma. Probably you can reframe the sentence. For infants, what would be the right age to start semi-solid foods, and what type of cereals can be given? Uh, oh, okay, Sanskrit. That's actually a very good question. Okay, um, we normally say, after maybe 7 months would be the right time to do annaprashna. Okay, that means you're slowly starting into something which is not what do you call non other than the milk of the mother. Okay, external food, and it is not good to give your child, not expose your child to too much. I would say even if it is not there, also it's fine. Salt or sugar to the child is somewhere around 7, 8, 9 months, because the two reasons. Okay, one is that sweet. If you give the child get so used to sweet, the child refuses to eat anything that is not sweet. That is bad. Second thing is that salt and sweet. Salt is something which has to be what you call filtered and all those things by the kidneys. And kidneys are formed, but till the child is about 9 months or 10 months, I would say go extremely low on something which is salty, because the kidney has to work extra hard to filter that. Okay. Babies older than 2 months can, no, babies older than 2 months, if breast milk is sufficient, you need not give anything else for the child till the child is 7 to 8 months old. Absolutely not. Okay, after 6 months, yes, you can start giving the puda if necessary. But I would say that the breast milk would, but probably the number of times you breastfeed might go up. But by and large, breastfeed is more than enough. Okay, atik chutrita nashiye. That means milk is the only thing. That the reason why we consider milk as a superfood is because milk is the only thing that will subside hunger and thirst at the same time. The child is hungry, you give milk. When the child is thirsty, you give milk. The child is what you call sad, you give milk. So it is such a superfood that you can manage a lot of things. Okay, so I would say stick to breast milk if the breast milk is there. Ashwin Kumar, is distension of the bladder a cause for concern? Um, See, there is sometimes, distension of the bladder is normally seen more in women. I'll tell you why. especially women who are used to traveling. They feel that if they drink too much of water, they will have to pass urine, and the toilets might not be clean enough, so they refrain themselves from drinking water and passing urine. So, as I said before, cough is also an urge, a vega. Likewise, passing urine is also an urge. So, if you stop yourself from passing urine consistently for over a period of time, there is always a chance for you ending up with distension of the bladder. And distension of the bladder is not good. You will have issues with your heart, because the pressure in the abdomen is always high. So distension of the bladder is actually not a good reason. Or if there is other issues, like there's a growth or something else, it is actually not a nice thing to have. Normally, you should not have a distended bladder. Okay, period. Taking triple at night good for the system. My first question is, why do you want to take triple at night? Take triple as a medicine, and anything if you take to get your system right, in my opinion, is not good. You should basically get your system right by your food and your lifestyle. You eat the right kind of food at the right time, and you actually see what your lifestyle is. Are you doing proper exercises? Are you sleeping well at night? Okay, and as per the seasons, are you following the regimens told as per seasons? That is what actually improves your health, and not triphala. Triphala will balance your doshas, but after a point of time, you'll get so used to triphala that you'll get addicted to it. So your body will stop functioning without triphala. So I don't think you should be reaching there. Ashwin Kumar, too many questions. Super. Fatty liver syndrome. Why did you get fatty liver is one thing. Okay. Were you sedentary? Or look at your food, what you're eating. Mostly it is because of your bad lifestyle is why you get fatty liver. And anywhere beyond 5% of fat being deposited on your liver, we call it grade 1. And depending upon the grade, I think you should slowly start doing your exercises, Ashwin. Okay. Lifestyle is the key here. Then probably, see, there are a lot of, over a period of time, it can lead to cirrhosis. Non-alcoholic liver cirrhosis or liver problems are on the rise. It is basically because of junk food. Okay, one major contributor is cheese, mayonnaise, paneer. Okay, non-veg, all those things. When you try to eat it, not cooked properly, I mean, you try to eat it on a regular basis, you can end up with fatty liver. Okay, only thing is that you are not drinking, but still you can end up in fatty liver. See, salt is something which has to be salt is something which has to be filtered by the kidneys. Okay, because of the renal thing. Okay, and it is actually a strain for the kidney to. That's where you release. See, 90% of the salt from the body goes through the urine. I think you know that. A lot of things goes from the sweat also. So the kidney, if it has to overwork, then it's a problem, because the organ which actually controls the BP is the adrenal gland, which is like a cap which is on the kidneys. So if the kidneys get affected, definitely the cap on the kidney, that the adrenal glands also get affected. Your BP goes haywire. So it is always good to take salt in moderation. Okay. Yes. Vasamba is Vayamba in Malayalam. Okay. Vacha in Sanskrit. Acorus calamus, a botanical name. Yes, it is medhya. It works really well for the brain, for all conditions where you have got issues with intellect. Vasamba is indicated. Okay, but one thing about Vasamba is that it removes a lot of phlegm. It removes a lot of blockage from the system. And if you give too much of Vasamba, you'll see that the child vomits. Okay, so the dose of Vimber is very, very critical. It is very small dose, and you don't give it as such. Vimber is usually mixed with what do you call medicated or ghee, where you do a little bit of japa. It is mixed with ghee or with butter. Okay, and given it is only a small dose. It is actually good to clean the whole system, and the child starts talking better. Okay, there are studies which have proved that. It is recommended in Ayurveda, and it is not a fad. Okay, and Swarna Prasha, yes, it has been told that on a specific nakshatra you can give a child Swarna Prasha, and there are and now a lot of kids are being given Swarna Prasha. But in my childhood, I remember that we used to rub what you call Vasamba, also Eratimadram we call that. Okay, that is Yashti, and then a little bit of gold, ghee, and we have consumed that probably till the age of 5 or 7. Okay, so it is actually good. One second, next one. Okay, having a preterm child dealing with wet cough always. Okay. Got it. See, what you're doing is right. Okay, black tulsi concoction with honey. Yes, it increases body heat. You should, and I don't say it is bad, because the reason why the child is getting that cough is because the child is cold. Okay, that wet cold is more of that watery side of it. So you adding black tulsi conk with honey, it is actually good. And loose stools, you can see that there is a lot of phlegm, which will also be mucus, that will also go through the stools. It is fine, nothing to do major about it. Okay, and yeah, and see, antibiotics, I would say, if you keep, by and large, if you keep your child warm. And one other thing, what we normally do for a child, see, 1.2 years, the child might not be dependent on the mother right now for food, maybe taking external food. See what the child eats. Avoid everything that is uncooked. Okay, milk, dilute it and give. Okay, and I would say no fruits to the child if the child is actually getting a frequent cold and cough. No curd, no fruit. Okay, and see that the child eats food on time. And 1.2, the child would have started walking by now. See that the child actually is active also. Okay. How can we improve gut health? See, gut health, it doesn't happen overnight, or it doesn't happen with some medicines you take. It is the same as what we call about immunity. Just because you have got an infection there, like just like in COVID, they were telling, COVID is there in the next week, so let me start taking some medicines to improve my immunity. It doesn't happen like that. Everything is cumulative. Okay. If you lead a disciplined life, I would say 3 things majorly. If you eat your traditional food, which genetically you are used to, I'm putting it very clear, whichever food you are genetically used to, traditional, seasonal food, on time in moderation, first part. Second thing, you are sleeping really well at night. Okay, not sleeping at 2 o'clock, 3 o'clock and sleeping for 8 hours. I would say sleeping somewhere around 9 o'clock, 10 o'clock and sleeping for 8 hours. And the third thing is that you are moderately exercising. Your general health will improve, and in turn your gut health will improve. Just because you have some fermented food like kombucha or idli or dosa, or you see a lot of things on Instagram, those things will not, all temporary patch-up work. You have to be extremely disciplined to actually improve your gut health. And once your gut health improves, that means your Agni improves, you will be basically healthy. It is not very easy to actually reduce your eyeglass number, yes, but maintaining, yes, you can do a little bit of exercises, eye exercises. And the reason why sometimes we find it very difficult to drop our eye power is because we are so used to looking at the mobile phone or some screen or the other. The eyes are exposed, overexposed, and overworked. Okay, so that is something which you have to focus on. There are some medicines like Nayanamritam and all those things which will actually help you control or see that it doesn't progresses beyond a view a point. And there are treatments. I would say there are hospitals in Kerala which are popular for eye diseases, and they do a great work. The hospital is called Sridhariyam. They do a fantastic work. Okay, and they are specialists in eye disorders. But see, overexposure to light is also not good, right? You can give warm water, Sitaram. You can give warm water when the child is coughing, yeah. And see, sometimes when the child drinks milk, there's a tendency that the child vomits. Let the child vomit. Okay, lot of phlegm will go. The moment lot of phlegm goes out, you'll feel that the child relaxes or feels better. You can also take a little bit of heat and apply on the chest. See that the phlegm melts. Okay, once it melts, it's easier for the body to expel it. Warm water is good. Some people observe 3 days fast by drinking buttermilk only. I'm not sure what are the uses of drinking only buttermilk. Water fast is come out to be pretty common right now. Okay, all those things, as far as Ayurveda goes, all those things come under Langhana. Okay, Langhana doesn't mean completely shutting down everything. Langhanam yat laghavaya. That means you cut down. If you want to reduce, you reduce the nourishment to the body is Langhana. Okay, if you're somebody who eats a lot of food, but you cut down and say, no, I'm going to have only fruits for the next 10 days, that is also Langhana. So having only buttermilk is also Langhana. But I don't know what the person wants to achieve by consuming only buttermilk, because after a point of time, buttermilk is not just drinking buttermilk might not be good for the system, because buttermilk is not some buttermilk is slightly acidic. Okay, so it's not good to have it on a long run. But see, you should ask him why he did it, because I have not heard anybody do this before. Yes, I think it's a sign of Hashimoto, and you don't have to worry. As Sijana, you don't have to worry too much about that, because most of the time, if you are very disciplined and your stress is under control, your thyroid and everything, anti-thyroglobulin, everything will slowly settle. And in Ayurveda, for this, we initially what we do is we do a small vomana. We make the person vomit, and there are a few medicines which are Hamsapadadi Kashayam is something which can be actually taken for conditions like this. But I would say it's always good for you to consult a doctor and then see what are the other issues. Okay. I don't think you have to be too concerned about it. Can you see you? I would say, if you are somebody who is following cricket or you're following football, if you have got Messi playing and someday Messi is not available, you cannot substitute Messi by something else. If probably Tendulkar is not available, you can't substitute Tendulkar with Dravid. Dravid might also do a great job. Tendulkar does a great job. As I say, you cannot substitute pepper with green. You cannot substitute green chili with red chili. You cannot substitute red chili with something else. Okay, each and everything has got their own properties. But to be on the safer side, if you look at the heat or the potency which is got, okay, on the longer run, pepper will not do too much of harm, while red chili and green chili can do a lot of harm because of its what we call tikshnata, we call it sharp potency. Okay, Ashwin. So for preparations, I would say If you like pepper, pepper is something which you can use. It will not increase the heat in your system beyond a certain limit. Okay, and it is native to our country. While most of the chilies, I don't say all chilies, most of the chilies came from outside. Okay, so I think we have come to the end of all the questions for the day. Okay, so I'll see you next week, same time. Okay, till then, good night, good night. Thanks a lot.